When I talk about stacking to my audiences, there are always a lot of questions with respect to where do I stack, where would it be better to not stack and do an overlay. And I think it's really important for practitioners that are doing CoolSculpting to really understand where one would stack and where one would not. In my clinic, it's very common, and I'll tell you that I stack the abdomen, both upper and lower, almost 100% of the time. Typically the lower abdomen, we're using the Cool Advantage Plus applicator or an old Cool Max Legacy applicator. We're using the big yellow applicator on the lower abdomen. I don't believe in 4.5 years of CoolSculpting that I have not stacked the lower abdomen. Additionally, I treat the upper abdomen in the same fashion. Sometimes I'll use the Cool Advantage purple applicators kind of as in an oblique angle on the upper abdomen. But again, I'm typically always treating each area twice on the same day with almost 100% overlap. So areas that I stack almost 100% of the time would be the lower abdomen, the upper abdomen, the hips, and the back fat area. So really sort of the core of men and women is where I'll stack almost 100% of the time. Infrequently on the hips, if they only want to buy 4 purple cycles, I'll sometimes do more of an overlay if their hip is amenable to a greater surface area and we want to treat the whole area but just with the 2 cycles on the one side. That's when sometimes I'll do maybe a 50 or a 60% overlay. But in general, I'm stacking lower abdomen, upper abdomen, hips, and back fat always. Now, with respect to extremities, the upper arms, the inner thighs, those are areas that I typically use more overlay. So with respect to the arms, oftentimes I'll treat the arm with the Cool Fit Advantage applicator, the first run here and the second run from the elbow to the mid upper arm with the overlap just in the center. With respect to inner thighs, I'll use Cool Fit, the longer straight Advantage applicator more medially, and then I'll rotate it a little bit more posteriorly with about a 50% overlap on the greatest apex of the fat of the inner thigh. So with respect to extremities, I'm more overlay than I am stacking. Now when we're talking about a man, one of the areas in men that I almost always stack is gynecomastia. I might treat the gynecomastia straight across and then stack it at a little bit more of an angle on the second run to catch closer to their axilla. But in general, there's a good 80% overlap when I'm treating gynecomastia. Now, where do I not stack or even necessarily overlay? Well, those are areas like the chin. As I mentioned, if you watched me showing you positioning with my applicators, sometimes I'll stack the chin just centrally where I'll treat it, you know, on the right side and the left side with just about a 10 to 15% overlap in the middle. But if I'm treating it with just one Cool Max, with one Cool Mini, one Cool Mini centrally, I don't stack those because I don't want to create a contour deformity. That's the same with treating the inner knees. I don't want to create a contour deformity, therefore I treat it one time, and if they want more of a result, I'll have them come back 30 to 45 to 60 days later and have that area treated again. I'm treating calves with CoolSculpting, and when I'm treating the calves, I have 2 machines, so I'm dual sculpting. And with Cool Mini, I'll treat obliquely the inner upper calf, and with Cool Fit Advantage, I'll treat the posterior aspect of the other calf, and then I'll rotate. But I'm not stacking. So again, areas that I'm stacking: lower abdomen, upper abdomen, hips, back fat, and gynecomastia. Areas that I'm overlapping but not stacking would be the upper arms and the inner thighs. Areas that I'm not overlapping at all, in theory, the chin the inner knees, and the calf area. The last thing that I want to cover with you is CoolSmooth. It's the only applicator that's not put on suction. You just lay it on the skin. Now with that, you don't get the tapering, feathering effect of freezing. So I think it's very important to never stack the CoolSmooth applicator because you don't want to create a dent in the shape of the applicator. So when I treat the outer thighs with CoolSculpting, typically what I'll do is I'll treat one area and I'll overlap at the apex. I do treat each area twice on the same side, but never stack it. I always overlap it by about, call it 40 to 60%. So I think this should be pretty self-explanatory as to where I stack and where I don't, and why I stack and why I don't stack.